Say hi, world. It's Cora, girl. Kyler, can you say Cora?
Cora.
Can you say LCA?
LCA.
Good job. Are you ready? Mwah. Thank you. Oh, it's so nice. Take another kiss. Oh, so nice. That's so nice. If you're happy and you know it and you really want to show it, if you're happy and you know it, clap your hands. Clap, clap.
Clap.
Good girl. Hello again and welcome to our next video. Jacqueline and I decided that our next two videos should be more solo videos, just diving into exactly what the heck LCA is and what the heck Williams syndrome is, and just go more in depth into who Tyler and Cora are. Today, you gotta see sweet Cora girl. Now we're going to dive in head first into what is LCA. I am the person who made notes because I am probably the worst person to YouTube with ever. I like to talk a lot, I ramble, I get sidetracked. So, you know, ask my husband, it takes me 20 minutes to tell a 2-minute story. So, I made notes. Let's begin with what LCA stands for. LCA stands for Leber Congenital Amaurosis. And what that is, it's an umbrella under something called an inherited retinal disease or inherited retinal dystrophy. And dystrophy means that it is destroying itself. And LCA happens to fall under that. Now, but what is a retina? And what does it do? The last time I heard retina was in biology class, which I had to rewind and I had to refresh my memory on the parts of the eye, what affects our vision, and what the retina does. So I'm gonna give you the 411 in a quick condensed, try to be as least scientific as possible because I mean it's very complex. There's still some things I'm like, oh, I need to Google that again. But for the most part, I will give you the 411. So your retina is the tissue on the back of the eye. Here is an image that you can see exactly where it is. It's a very, very, very thin tissue on the back. It makes up about 65% of the back of the eye. So the retina's job is to receive light from the lens. The retina then turns it into neural signals, which are then sent through the optic nerve, just kind of like a wire, and goes to the brain, where then the brain tells us what we are seeing. The retina is made up of something called photoreceptors. Those are our cells inside the retina, and there's two different types. There are cones and there are rods. Both are responsible for light perception, just in different ways. Cones are the center of a retina. The cones are responsible for color and fine detail, to be able to read, to write, to recognize freckles on a face or a mole, anything fine detail. The rods are more for allowing us to see in dim lighting or even at night. It's important to know the job of both the cones and the rods because when it comes to vision loss and blindness, it is a spectrum. This is a giant myth when it comes to blindness, and I am guilty of thinking this way prior. I didn't have any knowledge. Now I do. I thought when you were blind, you see black. I was uneducated. I had never met somebody who was blind. So when I heard that Cora was going blind, I thought it was going to be instantaneous. I thought it was going to happen overnight, and I thought that one day she would just wake up and it would just be black. I was so wrong. I had no idea. It's a spectrum. So there are different types of vision. You can have peripheral vision, your central vision, you have night vision, and all of these are capable because of these photoreceptors, these cells in your retina, the cones and the rods. So it's important to know what those do because
Wikipedia, the two classic photoreceptors information used by the visual system.
I don't know how Google just heard me, but she just started describing what cones and rods were. I didn't even say, hey Google, but she heard me. Anyways, so it's important to know because Cora can't tell us. She cannot tell us what she can see. So we have to best guess by really paying attention to how she looks at things. Is she looking from the side? Is she looking from the center? They can, in the OCT, they can look at the layers of the tissue and see, okay, her central is diminishing. The layers are starting to get more mixed together and it's degenerating. But it's very important so that we can make the most out of the vision that she does have for as long as possible. So now you kind of understand the two types of cells that make up the retina. You understand what the retina does now. It is solely responsible, just think light, retina light. You need the retina to be able to process light, to send it to the brain, so then the brain tells you what you're seeing. Now let's talk about genes and how Cora was born with LCA. Everybody has, I believe it's around 22,000 genes in our body. You get one copy from your mom and one copy from your dad. Naturally, we are all carriers of about 10 mutated genes. You just never know unless you have genetic testing done or you meet somebody else who has that exact same gene mutation. It is called autosomal recessive inheritance, where one parent has one mutated gene out of 22,000, and then another parent has that same exact mutated gene. Each gene has a name so that they can be identified. So you have two parents who have that same exact gene mutation. When they meet, the child has a 25% chance of inheriting both mutated genes because everybody has two copies of the genes. So for Andres and I, for example, so you can better understand it, we are carriers of the CRB1 mutation. We had no idea until we had Cora. I have one healthy copy of the CRB gene, and I also have one mutated copy of the CRB gene, making me a carrier. My husband is the exact same. He has one healthy copy and one mutated copy. We passed both mutated genes to Cora. So she has two mutated copies of the CRB1, which is pathogenic, which means she could have had LCA or RP, which RP is very similar to LCA, but just a different onset. It's a little bit later in life. LCA is the most severe of IRDs. It is most commonly from birth. Many times, under the age of 1, they have a severe visual impairment. Some are born with only light perception. We didn't notice her visual impairment until 6 months old. So there's so much variability from one patient to the next. But the onset, in general, is below the age of 1. There are about 27 identified genes and still counting. The CRB1 mutation makes about 3% of all IRDs, and that is about 70,000 people worldwide. I'm not sure more of the recent statistic, but the last I found in the US, there were about 300 known cases. Now, there are many more still being diagnosed, many who have went undiagnosed because genetic testing for LCA has just it's been a more recent thing. So there are a lot of patients who just don't know the gene mutation, who have never had genetic testing done. So that number probably is a lot more. It's just about 300 known CRB1 in the US. So what are the symptoms of LCA? Like I said, there's great variability between one patient to the next. So I'm just going to go over the overall possible symptoms of LCA. I'll go more into detail about the ones specifically that Cora is exhibiting. So the first one, and is often the first clue that there's something going on with the retina, is nystagmus. If you follow us on Facebook, I did a whole post on nystagmus. If you are new to following our journey, I am going to briefly touch over what nystagmus is as well. So nystagmus is the involuntary movement of the eye. I love to call it dancing eyes because I think of her eyes as dancing. Up until 6 months, Cora had great, from what we could see, what we perceived, she had great vision. She could track items. We had no concerns. And then all of a sudden, one day, she woke up and her eyes started to flutter back and forth. At first, we thought it was just a moment with her eyes. We didn't think it was anything permanent. So we called the pediatrician. That got the ball rolling. That's what really started our journey, was the nystagmus. It gave us a clue that something was going on, and we had to figure out what it was. Since that day, her eyes have never stopped, and they never will. From what they told us, she will have nystagmus for the rest of her life. Even after she loses her vision, she still will have nystagmus. Another really cool fact that I found is that even when their eyes are closed, their eyes are still fluttering. And if you actually touch Cora's eye over her eyelid when she is sleeping, you can feel her eyes bouncing back and forth. It kind of reminds me of REM sleep, how your eyes keep moving. Nystagmus can go in a lot of different directions. You can have circular, you can have elliptical, you can have pendular. Cora has pendular, so hers flutter back and forth, and then occasionally she has a couple elliptical thrown in there. It just depends on how hard she's looking. We notice her nystagmus really picks up if she's tired. If she doesn't have her glasses on, her nystagmus seems to be a lot worse. If the lighting is too dim, really when she's trying to really focus on something, then we can tell that they kind of bounce more. So we make sure that the lighting is good for her. If we don't let her become overtired and we keep her glasses on, we've noticed that her nystagmus is pretty stable. We don't see periods where the best way I could describe it is go haywire. Another of the more first symptoms that you generally see is something called night blindness, and this is where the rods are affected. It's our ability to be able to see when it's dim or low lighting. After she was diagnosed and after everything, we processed all the information, I actually looked back at all of her old notes from the doctors that when they used all this medical terminology at that time, I had no idea what they were talking about. This was all brand new terminology. This was a brand new world. I was still processing everything. So once things had calmed down and I became more educated on it, I went back and I looked, and they actually were suspecting something called congenital night blindness, which is another IRD, or LCA. So they hit the nail on the head, but they were debating between her symptoms if it was just congenital night blindness, where it solely affected her at nighttime, or if it's LCA and eventually her cones would be affected and she would lose all vision that she has. This here is a clip of Cora when we first realized that she couldn't see when the lights were dim. I had went into her bedroom after nap time. It was daytime, so there was still the natural light coming in. It was dim, it was not dark. And it was after her first appointment, and I went in and I was very quiet so that she couldn't hear me, because we were distinguishing if she could see us or if she could hear us, because she has very sensitive hearing and she's always been very in tune with noises. I quietly creeped in and I was waving my hand in front of her face, and that was when we realized that she could not see if it was too dim, especially without glasses on. Our third biggest clue that something was going on was when we went to the first ophthalmologist, and they said that she was extremely farsighted, more than the average child. Most children under the age of 1 are farsighted because their eyes are still developing. Cora was more farsighted than the average, and she has a slight astigmatism in both eyes. That's why she was prescribed glasses. He said, we want to see if this helps her nystagmus. At that point, we didn't have a diagnosis, but come to find out, in hindsight, extreme farsightedness is a component of LCA. And farsighted means that they have trouble seeing things up close, which made complete sense once we figured that out. Prior to her glasses, here's a quick video as well. We noticed that when she would try to focus on a toy or anything up close to her face, her eyes would really start moving, the nystagmus, but then she also developed a little head bob, and she would just kind of, as you can see, her head is just kind of bobbing. She is trying so hard to focus on that object. When we went to see the neurologist, they explained to us that her brain is trying to compensate for not being able to see that object. It's almost like a tic. Since she couldn't see, her head was trying to fix her vision. Once we got the glasses on, to this day, she has not head bobbed one time, which is another sign that the glasses are working for her and the refractive error is being corrected. Another component is depth perception issues. Things like stairs can be a little difficult. That was another thing that we tried with Cora, grabbing a toy with her glasses on, without her glasses on. She has very controlled movements when she does have her glasses on without them. We've noticed a couple times she would grab for something and completely miss the object. She right now is going through a phase where she's pulling the glasses off because she now realizes that she can. So that's been a lot of fun trying to keep them on now. Up until a couple weeks ago, she did great with the glasses. Now we think that she's just a revolting 1-year-old who wants to pull them off because she can. With that, one day she was crawling and she crawled right into the wall. Another one that Cora has not exhibited is something called photophobia, which is light sensitivity. Things like moving from indoors to outdoors. It's very sensitive on their eyes because their eyes are not reacting to light like they should be. So it hurts their eyes. It is way too bright. So it takes their eyes a lot more to adjust, moving from one degree of light to another. For instance, indoors to outdoors, outdoors to indoors. From having the light off to flipping the light switch on. So far, we haven't noticed her having any sort of sensitivity to it, but we know this is common, and it's something that we're keeping an eye out for. With that being said, another common thing is something called paradoxal pupils, where their eyes do not properly react to light. We are surprised that she doesn't have any sensitivity to light because there have been a few times, actually all the times that we've been to the doctors, her eyes sometimes will react properly and sometimes won't. There was one time we got her up from a nap and her pupils were so dilated that she looked like she had her eyes dilated at the doctor's office. And they probably stayed like that for a good minute or two, which is a very long time. You think when you go from dark to light, your eyes almost instantaneously adjust and your pupils expand and constrict. Theirs can typically have a sluggish, they call it a sluggish reaction, a slow reaction. So it takes her eyes a little bit longer to dilate and to constrict to protect their eye. And finally, the last symptom I kind of want to touch base on is something called strabismus, which is also known as cross-eyed, or when your eyes do not move together. And this is something that we have noticed occasionally. Hers is not permanent, but occasionally her eyes will kind of, one will go one way and the other will go the other. That is something that can be corrected. There are a lot of interventions to try to help keep that alignment. There is something called patching, where if you have one eye that is stronger than the other, they patch the good eye to try to get that weak eye to work harder and work more to keep up with the good eye. But as her vision does decline, it is going to be likely that her eyes will cross. Like I said, there's the patching. There is also a surgery that will realign her eyes as well. Cora's team is made up of the retinal specialist. He is the guy who is checking and monitoring her retinal degeneration. He does something called an OCT, which is they measure the layers of the retina, and that he can track the degeneration in which areas are degenerating, the peripheral, the central. Then she also has a pediatric ophthalmologist who is keeping track of her refractive error to try to keep it as correct as possible. And he is also keeping track of her alignment of her eyes. We want to best utilize the vision that she has to not put any more strain on her eyes as possible, to protect her eyes from large sources of light, because that will destroy her retina. Cora's gene mutation is in the CRB1 gene, which we know that gene is specific on making a protein. I won't get too sciencey behind it, but that gene is what allows a protein to develop on the retina that acts as its protective layer. And without that protective layer, the light that is coming in from bright sources such as the sun, the light is just damaging the retina. This is for anyone's eyes in general. When you go outside, you always hear wear your sunglasses, protect your eyes, wear a hat, don't stare at the sun, you'll damage your retina. So you have this protective layer from these proteins that protect it from essentially destroying from the sun. There are UV rays that come down from the sun that can be damaging to your eyes. So for Cora, when she goes outside, since she doesn't have this protein that's protecting her layer, then what's happening is it is degenerating a lot more quickly than average. So they said that is the number one most important thing that we can do for her to prolong her vision, is to protect her from those harmful UV rays from the sun. They are going to be naturally drawn to large sources of lights. When she was little, we used to notice she would just stare at the light bulbs. At the time, we didn't think much of it, but now we know it's very stimulating for them. Cora is like the moth to a light. When we go, even if it's a little night light, if we walk into a room, she's following that light wherever we go. We are in the process of getting her into a low vision specialist that is going to help us find a pair of sunglasses with a tint that is going to protect her eyes from the sun, but that's not dark enough where she won't be able to see. We believe she does have a degree of night blindness. The dark tint will be too dark for her to see. So we have to find, they actually make red tint, they make yellow tint. I'm really hoping they make purple tint because purple's her color. Whatever color will help protect her eyes from the sun anytime we go outdoors, but at the same time allow her to see her world. There is actually one more quick symptom that I do want to go into because it's something that we kind of are experiencing right now. It's something called, I may be totally butchering this, but this is how I read it, Franz Chetty's oculodigital sign. That is the term for them poking, pressing, or rubbing their eyes with their knuckle or their finger. There's a lot of theories as to why individuals with LCA tend to press or poke their eyeballs. The overall consensus seems to be that it stimulates the retina and stimulates the electrical pulses. So when you close your eyes and you press on them, you could actually see a flash of light. So they are getting that stimulus by pressing on it on their eyes and getting it to activate those light cells. We noticed Cora around, I would say 8 months at nighttime. When she was trying to self-soothe, if she was very tired, she would do a knuckle rub. Here's a quick video of her kind of rubbing a little bit, but you can periodically see her getting her finger inside of her eye. She moved from the knuckle rub to poking. Typically, it was at nighttime, so we adjusted her nighttime schedule. We adjusted her nap schedule because we noticed that she did it when she was overtired. So we tried to get her to fall asleep as quick as possible so it was less time pressing on her eye. We recently have been catching her during the daytime. The glasses really slow her down because she has to get under her glasses and into her eye, which allows us to quickly get to her and distract her hands. We try to keep something in her hands at all times because when she's bored, if she's frustrated, if she's tired, that's when we notice the finger goes into the eye. It is a very, 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 very common thing. I am in a few Facebook groups. I talk to other families who have children with LCA, and this is a very common thing. And the answer to it is distract them the best as possible. There's not much you can do to stop them besides distract them and try and discourage that behavior because it can damage the fatty tissue around the eye, which causes their eyes to be more sunk in. It can lead to the development of something called keratoconus, which is the coning of the eye, and you run the risk of scratching your cornea. It's just not good to stick your finger in your eye for anyone. It's not good for anyone to stick their fingers in their eyeballs. So it's something that we're trying to work on. Like I said, distraction has been our go-to. No matter what we're doing, we always have one little eye on Cora to make sure that her fingers are staying busy and her hands are staying busy and they're staying away from her eye and her glasses. So I really hope this helped you understand a little bit more about what LCA is. If you hear LCA now, I hope you have a better understanding of what it is, what's going on, and we hope that you think of Sweet Cora Girl when you hear LCA and you now have some awareness of this rare eye disease. Thank you for tuning in and learning more about LCA. Next up is going to be Williams syndrome, so watch out for that video so you can learn all about Tyler and what makes him this special, super awesome kid, and you are going to see exactly why we love him so much. 2 things to always keep in mind when you hear us talking about Tyler and Cora is A, remember we are the lucky ones. They have changed our entire world for the better, and B, these 2 kiddos are going to change the world, and we cannot wait to watch them flourish and to thrive, and we hope that they remember us when they are doing great things in this world and moving mountains. So stay tuned for the next video. If you have any questions at all, comment below, send us a message, reach out. We would love to answer your questions, so feel free. We are open books. You can ask us anything. If we don't know the answer, then that might be a good question for us to take to our doctor to find the answer out as well. So the way I look at it, many minds are better than one. We hope that you are having a great week. You're staying happy, staying healthy, and stay tuned.